Our hospital has managed to transform itself throughout its history to respond to society's needs for healthcare. The first transformation was the actual founding of the Hospital de la Santa Creu back in the 15th century. This was the result of the merging of 6 church and municipal hospitals that led to a great medical restructuring in the Barcelona of the times. In the early 20th century, the hospital was transformed again to respond to the needs of a different time with new ideas. It was thus moved to an exceptional building from an architectural point of view, set up and organized in accordance to the medical criteria of the times. Various pioneer projects have been carried out in the buildings of the Hospital de la Santa Creu y Sant Pau, such as the incorporation of research into hospital activity, the first casualty service in Spain, and the setting up of the autonomous University of Barcelona.
The Hospital de la Santa Creu y Sant Pau today is a university hospital, part of the public health system, responsible for specialized healthcare in 16 health areas and for a population of roughly 450,000 people. Thanks to its excellent technical and professional quality, it is a benchmark hospital in highly complex processes. Every year, 250 graduates study their specialty as resident doctors at the Hospital de la Santa Creu y Sant Pau. It is the headquarters for various different undergraduate and postgraduate training centers. The hospital maintains a permanent commitment to basic and applied research with internationally renowned projects. It is also headquarters to other health-related institutions in the fields of care, research, and the management and publication of health science knowledge. However, the 21st century has brought in new needs for medical care, deeper knowledge, and new technologies. We cannot respond adequately to this new situation from our old age buildings.
Just like other significant moments in the history of this hospital, we have to transform it again today in order to keep on advancing and improving.
A new building has therefore been erected in the northern part of the premises, designed to meet new medical care needs. This building enables us to improve the functional organization of the hospital,
provide greater comfort for patients and their guests,
improve the working means and atmosphere for professionals,
promote integration in the health network.
This is a significant change to make our hospital's services even better.
The Hospital de la Santa Creu y Sant Pau building includes all its medical care in a single element made of 5 blocks. Units and services are grouped together in 3 care areas, depending on their functions.
the outpatients area on the upper floors of Block A.
The inpatients area on the upper floors of Blocks B, C, D and E.
And the diagnosis and treatment area under the blocks, taking up the whole floor area of the building. Here is where the core of the hospital's technological care lies.
Surgical unit.
Equipped with 18 operating theatres and 27 post-surgery resuscitation points.
Obstetrical unit.
With 3 maternity wards, 2 clinics and 5 multi-purpose rooms.
Heart surgery area. Intensive and semi-intensive care area.
81 care points divided into adults, children and newborns.
Accident and emergency unit.
61 care points, separate waiting room and children's area. Direct access from Carrer Sant Quintí.
Image diagnosis.
Equipped with state-of-the-art technology, with an area mainly dedicated to accidents and emergencies.
All these areas and facilities are functionally related. They are located on the same floor and directly communicated, which promotes the efficiency of the medical care processes.
The following areas are on basement 2. Nuclear medicine,
Radiotherapeutic oncology,
pharmacy, totally automated,
pathological anatomy,
immunology, biochemistry, the hematology laboratory, genetics, molecular biology and microbiology, which automate and share common processes.
sterilization, automated and vertically communicated to the surgery block.
Other support services complete this floor. The area has a loading and unloading zone.
Inpatients area.
Inpatients are grouped together on the upper floors of blocks B, C, D and E. Ophthalmology is on the ground floor of block E, together with 3 operating theatres. The inpatients area hosts 15 different units, most of which are multi-purpose. Each unit takes up 1 floor and boasts from 16 to 25 wards, a waiting room for guests, and a medical care area with various workrooms. There are 275 outward-facing sunny rooms with a capacity for 520 conventional hospital beds. Access to this area is through the main hallway on Carrer Sant Quintí.
Outpatients area.
Just about the whole outpatients area is in Block A, with 202 rooms for consultations and exploration on 3 different floors. Floor 0 is exclusively for the day hospital, with 106 care points, almost double the amount in the old hospital. This block is completed by the blood-taking zone next to the hall, a public cafeteria, an assembly hall, classrooms, a chapel, and the administrative area. The patient's entrance to this building is on Carrer de Mas Casanovas.
Such is the layout of the new Hospital de la Santa Creu y Sant Pau, a hospital that has changed from an architectural model based on different buildings into an integrated centre, designed in accordance with the care processes. There will be a further building for research, clinical pharmacology and epidemiology, together with management and administration areas. Finally, the project will be completed with the definitive location of psychiatry and rehabilitation in a new building.
The modernist buildings are a World Heritage Site and will be restored. They will make up a social sciences campus for international institutions involved in the development of the Mediterranean area.
Together with the architectural and functional renovation, the hospital's strategic plan promotes technological innovation and the implementation of new management and organizational systems. Systems to reduce response times, ensure that data is exact, and make clinical management more efficient. Systems to enable immediate exchange of data amongst hospital professionals and those at other healthcare centers.
The new hospital promotes the development of teamwork and organizational agreements among different services in a setting of transversal collaboration that is less hierarchical and more functional. All of this helps to improve coordination with the primary healthcare network and nursing homes, thus making it possible to provide continued care for patients at various centers.
This is the new Hospital de la Santa Creu y Sant Pau building. A project that has become reality to improve working means and conditions.
More comfortable for patients and their guests.
A hospital that develops its technological and organizational capacity with the new equipment and new patient-oriented management systems.
The outpatient service has been significantly improved and better integrated into its health area. A transformation that enables it to maintain its career as a benchmark hospital, taking it to the highest levels in healthcare, teaching and research.
Hospital de la Santa Creu y Sant Pau. Once again, a new building marks the beginning of a new chapter in the history of our hospital. An institution that has today renovated its commitment to society. Because at the Hospital de la Santa Creu y Sant Pau, the future starts today.